Do I need donor eggs? There are two main reasons why women will approach us for egg donation. The first one is because of their age, and the second is because they may have gone through premature menopause. So we know that age is very important when women are trying to get pregnant because we're born with all of our eggs already in the ovaries and we don't know how to make new eggs. So the older we are, the harder it is for us to get pregnant because we've got fewer eggs, but also the eggs have been in the body for longer and they're not as nice as younger eggs. So once we get into our 40s, it can be quite difficult to get pregnant even with IVF. Premature menopause affects about 1% of women under the age of 40 where they just run out of eggs. And in that situation, because we're born with all of our eggs and we can't make new eggs, we don't know how to, they will also struggle to get pregnant because they have no reserve of eggs left in the ovary. So they're the two main groups of women who will need an egg donor to try and conceive. And egg donation in Australia is difficult because we're not allowed to pay women for eggs. And women have to go through an IVF process in order for us to extract their eggs to then donate to you. And so there is no line of women going out the door wanting to donate eggs because they have to go through an IVF process with injections, a procedure to take the eggs out, which is quite onerous on a woman. So because of that, most women find their egg donor by asking someone that they know, be it a family member or a friend, because this woman isn't going to be paid for their eggs and they know you and they love you and they want to help you and that's their motivation for donating their eggs. Now, for some women or some couples, this is important because it gives the woman a genetic link to the child because the egg donor is a family member, a sister or a cousin, and it gives the woman a genetic link to the pregnancy. For some couples though, that's just weird and they'd rather have someone they don't know donate eggs. And the options there would be to go online, and there are forums online where women and egg donors can meet. And what you would do there is put your story on the forum and then women approach you to offer you their eggs. Again, women aren't being paid for their eggs, and there are women out there who have completed their families and they want to help other women. This is why they're donating their eggs. The other way would be to use egg banks, and there are some egg banks around, bearing in mind that these will be frozen eggs that you're using and we don't have a lot of data in terms of people who've been born from frozen eggs. So I think the preference would be to have a woman donate eggs that you would fertilise with your partner's sperm straight away as fresh eggs, and then we can freeze embryos to then help you to conceive with the donated eggs. Now, the important things about egg donation are that the egg donor is not paid for their eggs. This is very important because it would be illegal if the woman's paid. But also, all egg donors' details, they are kept on a central register which is held by the government, so that any child or children that are conceived, they can find out who the egg donor is if they want to. Now, no one's going to write the child a letter when they turn 18 to tell them this is how they came to be. It's because you, as their parents, have told them that this is how it happened. And if they want to find out where they came from, they can. For donor-conceived people, it seems to be very important for them to be able to find out where they came from if they want to. So that's why that's there. The other reason why the egg donor's details are held is because we also need to keep an eye on how many families egg donors are making. And some women are there thinking they don't need their eggs anymore, their family's completed, they might as well help all these other women, and it makes them feel good to help all of these other couples and make them happy. And what you don't want is lots of half brothers and half sisters running around who don't know they're related to each other. So that's why egg donation, the donors are monitored to see how many families they create. So within New South Wales, they're only allowed to create 5 families in total, one being their own, so they can help 4 other families, and then that's it, they can't be an egg donor anymore. And we will cross-check interstates as well to make sure that the egg donor hasn't created too many families. So that's the legalities behind using an egg donor. And in terms of what would happen is, one of us as a fertility specialist, we would want to meet the egg donor to make sure that medically she is fit and healthy to go through an IVF process for you to donate you the eggs. There are risks of going through IVF as well in terms of the egg collection procedure, because all procedures have risks, and the egg donor needs to understand these risks. The egg donor will get genetic screening So we trace back through the family tree, make sure there's nothing obvious coming through. But also she gives a blood test, and we do a screen for different genetic conditions through the blood test. She also gets infection screening, hepatitis B, hep C, HIV, chlamydia, gonorrhea, those sorts of screens. And she also gets a lot of counselling. And if the egg donor has a partner, the partner's involved in the counselling as well, because they also need to work out the implications of donating their eggs, because they often have had children of their own. So they need to work out what they're going to tell their children, because if they're your family member, then your children and their children, they're not cousins, they're actually half siblings. If it's a friend, then they also need to work out what to tell their children, because your children and their children aren't family friends, they're actually half siblings. So they need to go through what they would tell their family and how they would manage all of that as well. So there's a lot of counselling involved for them too. And the partner obviously needs to be involved in all of that and needs to be supportive of the donation that's going to happen. Ideally, the egg donor is someone who's in her early 30s. Okay, because she should have plenty of eggs to donate, and the eggs should be relatively good quality eggs, and therefore your chance of pregnancy, even if you were 44, your chance of pregnancy would be as if you were 31, because that's the age of the egg donor. So ideally your egg donor is someone who's in her early 30s. Ideally the egg donor is someone who already has children of her own. Okay, that way you know that her eggs work. Now these are not absolute qualities that the egg donor needs to have. They are what we would ideally recommend that your egg donor has. So sometimes I have a patient whose only option is her friend who's 39. You know, the chance of pregnancy would be lower using a 39-year-old egg donor compared to a 31-year-old egg donor, but that's your only option. And you understood that those were your chances, the effect that would have on the chance of pregnancy, then sure, we would go ahead and use that egg donor. Other women will come with a younger sister who hasn't had children yet. Again, as long as that woman understands the risks of going through IVF and still wants to help and still wants to donate eggs, we can proceed with that arrangement. So they're not absolute qualities that the egg donor needs to have, but they would be what's recommended. So if you have any questions at all about egg donation, feel free to contact one of us at IVFAustralia. Thank you so much for watching. Don't forget to hit the subscribe button below, and I'll see you later.